Hello, Health Communications class. I hope your day is going well. Let me introduce myself. I am Jill DeBoeuf, a registered health information technician. I have been working in health information management services for over 18 years, and I have seen firsthand the change from 100% paper records to the current EHRs. So when you think about EHRs, do you think, geez, when I go to the doctor, he's always looking at his computer and his keyboard? Or do you think, gee, it's great that I can email my doctor or get my lab results or radiology results online? It's probably both. You think it's probably both a hindrance and a positive. And today I'm going to cover the high-level benefits and challenges of the EHR. I believe this will help you understand where EHRs are at today. And I think it is important for you to know about EHRs as a patient so you can be informed about how they affect you, your doctor, and your health communication. So let's start off with the benefits of an EHR. And that first one is just the instantaneous access, where in the paper world, only one person had access to that paper record. In the EHR, multiple people can be looking at your record at once. And even your doctor, if he's at home, when you come into the ER, can log in and help assist in your care. I liked an article in World Disease Weekly in March of 2006 that talked about a local healthcare facility, Winona Health in Winona, Minnesota. The CFO, Mike Allen, had this to say after they implemented their EMR. The integrated EMR improves the quality of care we provide with instantaneous documentation of and accessibility to patient information. Quick access to patient information throughout all healthcare entry points is a definite benefit to our community. So we can see that our healthcare providers and the team benefit greatly from the EHR having multiple points of access. You also, as a patient, have the ability to access your information online. No longer do you have to get printed copies or call the doctor for things. You can look them up and you have access. And HIEs are just developing right now. HIE stands for Health Information Exchange. And what that does is have the ability to take your record at our current site and push it to another site. So say you got in an accident when you were on vacation hundreds of miles away. The current site would be able to send the information for the pertinent things like your allergies, your medication lists, and anything that would help care for you. Another big advantage of EHRs is just that better patient safety, which leads to better patient care. So we've eliminated handwriting, which was hard to read. We have more thorough notes because they're hitting all their target points. And there's definitely features to warn of adverse reactions. And I found an interesting article called EMR Debate Presents Benefits, and which was a debate between two doctors about the benefits and challenges of the EHR. And the article was in Ophthalmology Times, March 2010, and there were two doctors, Dr. Lim debating the pros for the EHR and Dr. Quigley debating the challenges of the EHR. And in this article, Dr. Lim points out half of the serious medication errors are related to insufficient patient information or drug information while e-prescribing. Ordering medications within the EMR can provide several safety stops, such as alerting providers of allergies, errors in dosing, and drug interactions. And these are all great things that help make it safer for you as a patient and as the provider for not having to remember absolutely everything. There's also a summary of medical devices, and so when you can't speak for yourself and you can't even sometimes remember how long ago something was implanted in you and what it was, a summary of medical devices helps do that. There's also clinical decision support tools, and what these are checklists. So if you get a new diagnosis, the checklist works the provider and care team from A through Z and make sure that nothing is missed with that new diagnosis for you. Another advantage of the EHRs is just that there is efficiencies. There's self-entry tools with templates. There's dictating with speech recognition where the words populate right in front of the provider and they can correct them if they need to. Patient forms can be done online ahead of time, so you don't have to wait in line if you've done your forms ahead of time. And they give different patient information and instructions in different languages. I can remember when we only had English language instructions, and now we have multiple languages. It also improves the coordination of care. So when a patient discharges and say goes to the nursing home, we're able to send information to them electronically before the patient even gets back to the nursing home. And there's certainly challenges with the EMR. And as I alluded to in the beginning, one of the challenges is that loss of patient contact because the provider's looking at the computer screen and at the keyboard and has lost that touch with you, being 100% attention. The other part is, even though there's efficiencies, it also does slow down the provider. And I'm going to refer to that March 2010 article again, EMR Debate Presents Benefits in the Ophthalmology Times again, focusing this time on the doctor who's debating the challenges of the EHR, Dr. Quigley. And Dr. Quigley says of the EHRs, it has to be faster than paper. And features he would like to see in the system include a minimum number of keystrokes, instant movement from one window to the next, and all the information available on a single screen as much as possible. He's not a data entry clerk, and he doesn't want as many clicks. And you can see that as being a disadvantage if you're the doctor. Another disadvantage, of course, is those high costs to implement. The website healthit.gov has a web page that talks about the cost of the EHR, and the web page starts out with the heading is, how much is it going to cost me? And the statistics provide that several studies estimate the cost of purchasing and installing an EHR ranges from $15,000 to $70,000 per provider. So it's not hard to take 10 providers and say that would be $150,000 to $700,000, and that's just for 10 providers. And we know the large facilities, that gets into the multiple millions. There's also, with the new HRs, there's new ways to make mistakes. And one of the main mistakes is copy and paste mistakes. And Mary Butler describes a firsthand account of a copy and paste mistake. And she is an author of an article in the Journal of AHIMA in March of 2015, where she talks about an incident where Julie Dooling, a director at AHIMA, talks about an incident as she was receiving care for her mother at a hospital. The nurse for her mother kept referring to her mother as sister, and then kept asking her about a knee surgery that had never happened. And Julie right away stated, this is when I knew something was wrong and suspected copy and paste was the problem. So the ability in the electronic record to go ahead and take and copy and drop in does present disadvantages. So in conclusion, I would like to say, as patients, we expect the best technology when it comes to our healthcare. I have shown you the high-level benefits of the EHR in the areas of instant access, better patient safety, and increased efficiencies. I also outlined the challenges of the EMR in the loss of patient contact, the slowdown of the doctor, and the high cost of implementation and potential mistakes. With this knowledge, you are now more informed as a patient about EHRs, who is better able to direct your own care and health communication. Thank you.